Okay, so this is Lauren. Lauren is a dancer with Ballet Hispanico, and she has a few different complaints that have been limiting her somewhat with her dancing. And so, why don't you just tell us a little bit about those, Lauren?
Let's see, let's go from the top to the bottom.
Okay.
So I've been having some pain in flexion, mainly when I bring my head to my chest. I also am having an issue on with my left shoulder when I have to bring my arms overhead. It just feels a lot more constricted in the back of the shoulder. Left hip is problematic, and it creates problems in my back and in my pelvis. In particular, my left ankle, I get some kind of impingement or pain sometimes when I point my foot, especially when I'm engaging through the big toe and when I go up on my releve.
Okay, so now I'm going to have Lauren come into releve. And you can see that she almost at the end has to kind of tilt out to the side there a little bit. She's working a bit harder through her foot. Any discomfort with that, Lauren?
Yeah.
And you can just see a little bit of bunching kind of right there, right where her hip meets her low back. How does that feel for you?
Feels more strained.
Look at the left leg. And you can see the left leg's just tighter. It's just harder for you. Does it feel uncomfortable at all?
It's just hard to feel blocked.
Okay. And the left side? And you can see she has less motion and her pelvis has to tilt when she does that. Any discomfort when you get there?
Yeah.
Get on the left. Good. And how does that feel on the left?
Just like I'm picking up with
Yeah.
the side.
So I'm going to have you coming up high fifth with your shoulders now. Good. And you can just see that she gets a little less motion on the left. Any pinching or anything on your left side? Just right back there. Okay, and now I'm just going to have you roll your chin down towards your chest. Just tell me at what point you start to get discomfort.
Right there.
Right there. Great. Okay, and so now I'm just trying to loosen Lauren's AC, or acromioclavicular joint. So I'm just trying to get a little separation here. Lauren, just gently press up against my shoulder, my hand. Good. And let it go. I just want you to let your belly and chest fall forward. Good. Now I'm just trying to do a mobilization to try to loosen Lauren's middle spine here. So I just want you to go ahead and now gently press your arms down towards my arms. Good. And let it go. Okay, so now, because Lauren's lacking the ability to kind of move her leg out to the side, I'm just going to do a hip joint mobilization to try to get that a little bit looser. So I want you to go ahead and gently press your thigh down towards the table and let it go. Now to kind of work on some of the problems Lauren's been having getting into arabesque, I'm just going to be kind of taking her hip back into full extension with her body on the table and just kind of mobilizing her pelvis a little bit here. So now go ahead and gently press your thigh towards the table and let it go. And press your thigh towards the table. So again, because she has trouble coming into releve, I'm working on her ankle in plantar flexion or in the releve position. So now I'm just going to find where her talus does not move. I'm going to have some pressure on it. Now Lauren, I just want to have you to go ahead and sit your tush back towards your heel. Good. And now come back up and do that a few more times. Do that. Go. Right there. Don't lose it. Good. And now the left foot. Good. How does that feel on the left foot right now?
Much better.
Yeah. Is there any pain?
No.
No. And then you can see that she kind of gets up higher, can keep her foot straighter, and it looks just more stable. Let me see on the left, please. Good. And how does that feel on there?
Much better.
Yeah. Okay, to the left again. Good. And you can just see she gets more range of motion. How does that feel for you?
Much better.
Yeah.
It's not getting stuck anymore.
Great. Side. And again, you can also see she gains some range of motion going out there, and just kind of the stretching that adductors, or adductors. Yeah. Okay, so let me go ahead and look at high fifth. Good, and you can see she gets better range there. Any pinching, any discomfort through that left shoulder? Okay, so I'm just going to have you roll down again and just see how that feels. And how does that feel for you?
So much less restricted.